Let me talk to you guys a little bit about who potentially can benefit from a carnivorous diet. It's not that I advocate that everyone in the world try a carnivorous diet. I hope that doesn't happen because it'll drive the prices of meat pretty high, and we don't want that to happen. But seriously, I think the folks that benefit the most are people that are having health issues. And I think particularly people with autoimmune conditions, things like rheumatoid arthritis, psoriasis, particularly some of the gastrointestinal problems like Crohn's disease and ulcerative colitis have responded really well to a carnivorous diet. And I think that those people probably, should certainly give it a try. I think there are, it doesn't mean that that's the absolute ideal diet for every single person, but there are certain people that have failed, medications, multiple other diets, and it's certainly worth trying. I think that people that have unresolved health issues, rather than trying the next latest pharmaceutical drug, it might make sense to try a different diet. And certainly a period of 60 to 90 days is often a good trial period to kind of see how your body will adapt to the diet. Now, certainly there are transition symptoms that you have to be aware of. Talk about those in some other videos, but really, for those you guys that are doing well and are very healthy, there's no reason to do it. Now, there's some athletes that have found that their athletic performance has indeed actually improved. They've gotten stronger, they've gotten leaner. And I think those things are certainly something that you may want to try it. But I think for the most part, if you just can't figure out what in your diet is causing problems, and undoubtedly something in your diet is causing you problems, in most cases, for most types of medical issues, particularly chronic ones. Then an all meat diet, as we know, people can live on it for years and decades without any real nutrient problems. I mean, I've been now going on 17 months and doing just arguably very well with this approach. It is something that certainly there are some people who will find that they can heal their gastrointestinal tract somewhat, improve their gastrointestinal permeability. We're seeing that out of some of the research coming out of Paleo Medicina group in Hungary, where they're showing that intestinal permeability improves over time with a carnivorous diet, and therefore less incidence of leaky gut syndrome. And so you may after a period of time find that you're able to reintroduce certain foods back into your diet without problem. And I think there's nothing wrong with that. Some people prefer to remain strictly carnivorous. I know I certainly seem to feel best doing that, and so that's what I continue to do. But there is nothing wrong with experimenting to see where you're at, but be honest and be objective about it. I think one of the things that some people do is they get too attached to a particular dogmatic approach, and this fully carnivorous diet works very well for many people, and being strict about it works extremely well for a lot of people. And I think that's great, and I think those people should certainly try it, and they should certainly try it in that capacity and see how they do, and then compare it to a different way. And if you think that adding something to the diet either improves or makes it worse, then you should be free to try that, test it out, and see how it happens. But I suspect many people will find that they ultimately just do better straight up on a straight purely carnivorous diet. But that's up for the individual to determine that. I think this diet is appropriate for pretty much any person on the planet with very rare genetic sort of inborn errors of metabolism, exceptions around protein metabolism. But for the most part, that affects such a small percentage of the population, it's not even worth really making all those points. If you have that, you already probably know you have that condition. But and why is that? Because human beings, and human beings go back, roughly 3 million years to our forebears, things like Homo habilis, Homo erectus, and so on and so forth. We were meat eaters. We were incorporating meat in our diet. It's something that's always been part of our diet. There are novel foods that were introduced much later in human existence. If we look at this 3 million year time zone, then we go back to 10, 12,000 years ago when agriculture was started, when we introduced grains. Much of the vegetables that we eat today were not invented. They just didn't exist. And probably, in my view, of the plant parts that were probably safer to eat would be things like fruit. Unfortunately, they have a lot of sugar in them now. They're bred to have quite a bit of sugar in them, and so they have probably a little less toxicity to it. And then perhaps some of the underground storage organs, like tubers. Those things, again, but those are high in starches, and potentially they can be an issue for people that have problems metabolizing high amounts of carbohydrate. Not everybody has that situation, but some people do. And I think the things that often get all the press, the leafy green vegetables, the stems and things like that, those things tend to be things that plants do not inherently want us to eat. They tend to have a lot of chemicals which can be problematic for some people. Some people tolerate them well, but some people it's an issue, and I think it's something to sort out. And so I know there's a lot of information that encourages us to eat leafy green vegetables and cruciferous vegetables for various reasons. You know, those things are typically isolated conditions, typically using isolated studies, looking at cell compounds or specific isolated conditions in animals and sometimes even in humans. But you have to remember there are also things in those plants that some people don't tolerate well. So you just need to sort that out for yourself. So carnivore diet is worth a try for anybody who's having issues, for somebody that just wants to try it out. But I'd recommend giving it 60, 90 days. Try to do it strict, try to go strict as possible, do it the whole time, and then just kind of see, compare. There's nothing wrong with doing that. Hopefully you'll find the right diet for you. Maybe it'll be carnivore, maybe it'll be something else, but I think it is certainly something that's reasonable to try. And as I see day to day, the thousands upon thousands of people that try it and get some pretty remarkable improvements in their health, particularly things with again, the autoimmune diseases, the arthritis, the gastrointestinal problems, some of the mental health issues that are going away. We've also seen conditions, things like autism and fetal alcohol syndrome in kids, where their behavior and their performance improves. So those are all compelling and interesting things to see. We'll hopefully get more study on this as time goes by. We are informally studying this currently and trying to collect data. But that's just something that's on the horizon, and hopefully we'll continue to see how much, like I like to say, meat heals. All right, guys, you guys take care, and we'll talk to you in the next video. I try to address questions in video format rather than typing to responses. I know I get a lot of sort of hate mail on the responses, which I fully expect. I mean, you've got some people that are dogmatically sworn to a particular agenda, and they don't like to hear anyone challenging some of that research. Much of nutritional research is just based on epidemiology. It's all just observational studies, and unfortunately, it's not the researcher's fault. It's just not a very good tool for determining what we're supposed to eat, and it doesn't apply to everybody in every single situation. And we have to realize the limitations of the nutritional research and not believe it is the gospel, because it's not. There are things that change all the time, and the studies come out and they contradict each other all the time. That's because we don't know, and it's likely we may never know. So the best advice is try it yourself, be objective about it, see how you do. All right, guys, take care.